A lot of stuff last week.
Yes, we were busy.
Item number 14 is receive information from county employees. Anyone from the county? Christy, how about giving us a coronavirus or what is CV? I'm supposed to use something else, I apologize. It's CVD 19 or something?
Yes.
Okay. Could you give us an update on what's happening, where we
So
are?
the team's coming up here.
Okay, beautiful.
Christy, Roby Williams, Director of Public Health for Muscatine County, and with me is Holly Barrett, our clinical manager, who also oversees our public health emergency preparedness and communicable disease surveillance and investigations, and Brian Wright, Board of Health, and serves as our county's emergency manager. So we are working closely, as you know, with the Iowa Department of Public Health, who is working closely with the CDC, who is working closely with the World Health Organization. Our one true source who we go to for our fact finding and information is the Iowa Department of Public Health, and we would continuously recommend the community go there for your facts and to know how to prepare as individuals and as a community.
So Christy, before you go too far, how do they get there? Is that
So
a,
they have to have internet access.
okay,
So if you have a device but you don't have internet access, you certainly can go to the library and take a laptop with you or a phone if you have. And it is idph.iowa.gov. If you go there, I don't have to tell you where to click, because as soon as you get on that page, you'll see coronavirus updates that pops up at the top, and you just click on that link.
thank you.
Great question. They have all of the facts there on number of surveillances, preparing, travel considerations, general prevention, and then additional resources for businesses, schools, healthcares, long-term care facilities, and for the general public. So that's your one true source. Go there for the facts. I want to empathize with our community. I have my own family. I was born and raised in Muscatine County. Things like this do feel scary. It's called a novel virus for a reason. It's new. It's unknown. But there are scientists on top of identifying a vaccine, working diligently from across the world to bring some more understanding to this. So all we can do is fill our minds with the facts and not the fear. So that's what I ask of the community. We did release last week publications to all of our newspapers that we know go out Muscatine County wide. That's Discover Muscatine, Voice of Muscatine, and the Journal. We want to encourage folks in that, just letting them know we're still working with Iowa Department of Public Health, our state, local, state, and federal partners, but that there are ways how you can prevent and spread all viruses, including influenza, that has taken many lives throughout the United States, is cover your coughs and sneezes with a tissue or your upper arm or elbow. So when I see people or sneeze into their hands, that's not an effective way of covering. That is going to spread a virus immediately. Clean your hands frequently with soap and water, 20 seconds. I jokingly have told my team, I remember when my kids were little and I'd sing the ABCs to them. Do that. Be intentional, conscious awareness. Make that practice happen. We are so busy and rushing from place to place that we forget that one little step, and that can definitely help reduce the spread of viruses and bacteria. The other would be as you're going in and out in public places, if you can use a tissue when you're grabbing a door handle, a paper towel, a sleeve, anything like that, that is beneficial to your health and the health of others. And if you are ill, stay home. Please do not continue spreading the infection of viruses and bacteria. We have a lot of people still being diagnosed with influenza in our county, and there are a lot of folks that have compromised immune systems in our county. That puts them at a very high risk for hospitalization and further health condition complications. So we just want to ensure that the public is aware of that. Not yesterday, we received correspondence from the Iowa Department of Public Health, and Holly and I have been working closely in getting communications out. The Iowa Department of Public Health is offering webinars to businesses, hospital administrators, child cares, schools, What else am I leaving out?
I think the K through
The
12,
K through 12.
separate from the
Yeah.
preschools.
We have been in communication with all the chambers throughout the county, asking them to disseminate this information to all the businesses they're aware of. These webinars, again, are led by our doctors at the state, our epidemiologists. I highly encourage those folks that we reached out to about those webinars to sit in on those. Make that a priority, because they'll talk about preparedness, they'll give the facts, they'll share preparedness, and they'll offer a Q&A time, so you can ask those questions. Anything else that you wanted to add? That was good. Any questions?
Go ahead, Doug.
I was just wondering the impact this will have on travel as the virus spreads. I have a friend from Australia who's planning to come in April for Band Aid, and they canceled all flights out of Australia.
Yes.
It's got
So let me
57
pull up my
cases of
facts.
coronavirus there.
If I can see them. So, warning 3 level from the CDC. CDC recommends that travelers avoid all non-essential travels to China and South Korea. And alert 2, these designations are experiencing sustained community transmission of respiratory illness caused by the novel coronavirus, or COVID-19. And these are, the viruses can spread from person to person. These areas of non-essential travel that they're asking that you consider not going to would be Iran, Italy, and Japan. And watch level 1 does not recommend canceling or postponing travel to the following destinations. However, travelers should practice usual precautions, and that is Hong Kong.
Okay.
So I do know, there are folks that would just had travel plans to go to Italy, and, they're canceling those. Contact your airlines. They're aware of these travel warnings. They are working with individuals. They are, giving them their money back, helping them reschedule. So again, go to the Iowa Department of Public Health or CDC for those travel recommendations if you have travels in your near future. Businesses are encouraged to create their own preparedness. If there's not required travel, don't send your folks. So just being mindful of that. We all need to think preparedness, not just emergency management and the public health department. We all are responsible for that. And what are you going to do, and think through some of those questions that were in the press release. Residents should prepare for the potential of COVID-19 in the same way they prepare for severe weather or other events that could disrupt your normal routine. So this is where we need that intentional awareness. This includes making a plan and discussing it with your family, your what-ifs. What would you do if you could not go to work or school because of an illness? What if your daycare provider was ill? How would you get groceries if you were ill? These are all questions to consider.
I just want to make one question. On your idph.gov, does that kind of help people in the public understand what COVID is 19 if somebody were to hypothetically get it? Because right now I think one of the fears is this, life-threatening sickness that in reality I don't believe it is that. It is more of I'm not going to really put into words, but I think it's some sort of a system that gets into you, creates a potential almost flu-like symptoms, but eventually you do get through it if you do not have a lot of respiratory issues and you're not having a lot of those. Is that something
You
to
are
that correct?
The signs and symptoms mimic that of influenza.
Okay.
Those that have compromised immune systems are more at risk. So we know there are 2 cases of mortality in the United States.
Okay.
One was a 50-year-old, a woman in her 50s and a woman in her 70s in a long-term care facility. Both had underlying health conditions that made them more vulnerable to the virus.
But if someone were to feel they have that, and then, or even if they do get it, you're quarantined, you try to stay home, your body will eventually get through it.
Correct.
And it's not some disease that you're gonna get, that it's a goner type thing. And I think that's the message that I wanna make sure that we're clear that we're sending. If that IDPA just sharing that,
It is.
it helps us understand, so it's not this huge panic
Yes.
that, oh my gosh, somebody just sneezed over by me, I think I better go run home and I'm done. It's not
It's
that.
more
It's
likely influenza.
okay. Well,
And
and,
also,
Yeah.
that would be a situation where you get home, wash your hands. Yes, that's where the fear lies, is because it's new and
Yeah.
it's unknown.
and I think that's really what it helps us to help make sure that we're communicating to the public, we're allowing them to understand that, and I appreciate the time that you're taking, Christy, and your team as far as sharing that with us, so. Is there anything else?
We had an interview on television with a woman who they quarantined because she showed positive.
Yeah.
And she said she didn't feel any signs of being ill.
Yeah,
Everybody's body is
So-
different in how it accepts and receives a virus and copes with it. So if you have an compromised immune system, if you have signs or symptoms, contact your primary care provider first.
Yeah.
Call their office. They're gonna ask screening questions. Our healthcare system is working diligently on preparedness as well. Our hospital, our clinics, and all clinics throughout Muscatine County, not just Unity Point. Everybody is working on strategies to screen individuals and to know what next steps are. If there are concerns based off of this screening, the Iowa Department of Public Health will assist with testing and screening. Those can be tested at our state hygienic lab, which is at University of Iowa, so nice and close to home for us. And then if there are any positive results, there's quarantine done, there's monitoring that's done by your local public health department in collaboration with the individuals.
great.
Very good.
Thank you, Christy. Thank you.
Thank you, everyone.